Hey, hi, Mike.
Hey, Agner. Hi, everybody. This video is going to be like a discussion between myself and Agner, and hopefully there'll be a lot of information that'll be useful for everyone who's watching, families, providers, partners, community members. So my name is Mike Young from PASOs, Director of Capacity Building at the Central Office. And if you're unfamiliar, obviously PASOS is a statewide nonprofit that provides support for the Latino population of South Carolina through education, advocacy, leadership development, and connections to resources. And today we have Agner, and he is our Midland site coordinator. And I'll let Agner introduce himself and give a little bit of background of what he does on a day-to-day basis.
Hi, Mike. Hi, everyone. Thanks for doing this, first of all. I think it's a very, very good movement to do things like that to our community, to spread the information, spread the word, and make them feel maybe more comfortable that our organizations like us trying to work as a daily basis for them, try to help them go through this situation that everybody's struggling right now. So my name is Agner Munoz, with G and R, Agner. I'm the Midlands coordinator, as already Mike said. I oversee and supervise the progress of our programs in the Midlands. So basically, I'm in charge of the first line of defense, like I always say, right? So we have a team of community health workers working with our families and with our Latino participants, helping them achieve and overcome needs and situations as a daily basis. That's basically what we do in general terms.
Great, yeah, and your work, you're working with our team members on the ground throughout the Midlands, and you have a good, understanding of what's happening with the families, especially with this coronavirus, COVID-19 virus spreading and how it's affecting communities. And what we want is for families to feel comfortable and understand that they can come to us for a variety of supports and connections. Of course. So what we're going to do is just kind of have some informal discussion between you and I about what the work is, what it's been looking like for the families, and where people can go and how they can contact us. We do work with a lot of families, nurses, home visitors, and so on. And we hope this video will provide specific and relevant information to support their work.
Of course.
So Agner, first, how have you heard our families have been reacting to the COVID-19 threat?
So Mike, this situation has been something unexpected for everyone, I guess. So there is a great amount of uncertainty, fear of how to live in this unknown situation for everyone, how this is going to impact our personal finances, our social life, our emotional health eventually, because this is something that our generation has never lived before. Mm-hmm. So there's a lot of uncertainty and fear on what's going to happen eventually. That I think everybody has feel the same, even our Latino families in our city. So yeah, I think uncertainty is the main word that describes what everybody's feeling right now and how everybody's reacting. Like nobody knows how to react to this because it's the first time that we have been living something like this in our generation. Maybe 80 years in the past, but when the Spanish flu happened, yeah, but our generation has never lived something like this. So yeah, a great level of uncertainty is the best word to describe how families are reacting right now.
And when families and community members reach out to our team members and your staff, is the virus at the front? Is it the one of the priority issues that they're reaching out about, or is it?
Yeah, besides of being infected with the disease, which is the primary concern of everybody here in the States, the major concern is the economical impact. How these things are going to impact their finance. They now are worried about how they're going to pay their rent, their bills, like the utilities, the cable. How are they going to buy food, like those? How are they going to buy diapers for their children? So basically, the economical factor is the main concern besides being infected with the disease right now. That's a major concern, a major worry. They are very worried about it because some of them are not working, or they have been uh, receiving less hours for work because of the whole situation. I have participant that works in the hotel industry, so they are not working as a daily basis round. They're just working like maybe 10 hours a week. So yeah, that will impact their finances eventually. Of course, even though the governor has doing some mandates that nobody will be receiving utilities disconnections, and nobody can be evicted from their houses. Eventually, they will have to pay for those bills. So
Yeah.
they are concerned right now, and that has been, I think, the major concern of our
Okay.
communities. Yeah, of course.
That answered my next question. Thanks. And so, along those lines, what are some of the resources that you and your team have been providing that have been the most impactful for families with those concerns?
Yeah, so the primary thing is getting these families connected with the children's school districts that the South Carolina Education Department has been established a plan to feed their students in the whole state. So we've been connecting families with their respective school districts to let them know and how to connect them, how teaching them how to get access to those plans in every school has established, so their children have something to eat as a weekly basis. And of course, we have been connecting families with food banks such as Harvest Hope and Mission Lexington, that they still have their door opens to our communities and their families. So basically, that's been the primary concerns and connection that we have been doing. In terms of the economic assistance, like I told you before, even though the governor has mandated non-eviction and non-disconnection for the primary services, uh, we have been calling and connecting participants with organizations that offers economic assistance from, like, as Dominion Energy, Water Community Services, the Salvation Army also, and they have been attending our participants and our calls, because right now they are not giving the clinical assistance as right now, but yeah, we are open those cases because eventually they will be helping those families achieve those needs. So basically, yeah, the food distribution of the school districts, the food banks, and the organization that offers economical assistance for bill and paying the bill, the rent has been the most resources that we have been using right now.
Okay.
But of course, we keep continue enrolling people in the week services. We have been doing Medicaid as well, because those services hasn't been stopped. So
Mhm.
we've been doing as a daily basis. We've been enrolling people in the Medicaid, enrolling people in the week, making sure that they have those services and they keep continuing receiving those services.
Yeah. Community health worker model is amazing, because it's having to have all those resources available, knowing what they are, knowing what to navigate, but also adapting to what people's priorities
Oh,
are.
exactly,
Yeah,
exactly. Priorities change, and it has been changed with this situation, man.
yeah.
So the primary concern, as I told you before, is the economical assistance that they will need eventually to pay their bills, to pay the rent, to pay the medical bills, to pay everything. Yeah. So that's the primary concern right now, the economical assistance, man.
And can you tell us about a particular family or an individual that has shared their experiences during the time? Like, what would you say to anyone who's supporting a similar person or family?
Of course, I can share if you experience that we have as a daily basis, or like last week, I personally attended a lady that she was working for a chain of hotels right here in Colombia, in the downtown. She's not working right now as a weekly basis, so they call her like once every 2 weeks. So she's not receiving no money. right now. So her primary concern is her children. She has 4 children in different schools. So basically, I connect her to the school districts. I make sure that she was receiving the right information. And actually, in one of her school, offer delivery services for her house. So right now, she will receive the food for the entire week for the children in her house, because the school district that she is right now offered that services. Uh, so basically, that was her primary concern. We fulfilled that need. So she keep texting me, "Thank you. You are God bless you, God bless you," because she's so happy because her children are eating. And of course, we connect her to banks, food banks. So she's, as a daily visit, she goes once in a while and pick up some food for her to cook in her house. Uh, so basically, the main, and I can tell you this, the most important thing for them to hear is that you are concerned, that you worry about them. So I the main advice for everyone serving families like this is just follow up as a daily basis. Make sure that the person is receiving the service that you asked for that person, and that the need has been fulfilled completely. Don't leave things at the air, in the air. Like, just close every single problem that that person has, and the follow up. Just follow up as a daily basis. Just giving them support and comfort. I can tell you about another family, that Lisbeth, which is our CHW, in charge of the WIC system, in the WIC program. She also took care of a participant that has been living in the United States for a long time. He has been working as on his own, so he has never used any single assistance from the state. Now he's in the need of receiving that. So he reached us, and he was concerned that he has never used that, and he doesn't know how to do it, and actually that he's afraid to use it because he has never been used those assistants before. So Lisbeth calmed him down, telling him that's what the services are for, to help the people like you, help you with the struggle. So make sure that the person understand how to use those services, and make them understand that those services are for them to use. Is, that, like, make that simple. So Lisbeth made him comfortable uh, to use those services, and she took out the wariness about using them. But basically, yeah. So the follow up and the personal contact, and make sure that you understand that concern of that particular person is the main thing in these cases, Mike. Make them feel right, make them feel comfort, that make them feel that they are not alone in this, that there are people like us worrying about them as well.
Definitely.
Yeah, Mike.
Um, Going back to the coronavirus and COVID a little bit, I wanted to know, what have you heard about what kind of like misinformation about COVID are you hearing from the community, and also like, what kind of information are they asking for specifically?
Oh, there's a lot of misinformation in the social medias, Mike.
Mhm.
So PASOs and our team are making sure to share the right information, the official information from the right and the official agencies that has the right information and the research about it. Because there's a lot of like, I don't know, myth that out there. So it's very important for us to spread the right information, so people will not be exposing themselves unnecessarily using systems or methods that are not science proof already. Yeah. But in terms of those things, we haven't been asked about it. but we are not waiting for people to ask us about those. So we are sharing that information in our Facebook page. Everybody can go there and access. We have been sharing the DHAC information. Appleseed also has great tools in Spanish for our
Yeah.
communities. So yeah, everybody's doing their part, spreading the right information about the
Yeah.
COVID-19. Yeah.
Yeah, we have videos in Spanish. We have
Yeah.
different
Yeah.
formats. Yeah, websites. So yeah, definitely. If anybody needs a resource, come to our pages.
Yeah.
Um, how can PASOS and your team support partners who provide services to the Latino community in this time? How do you recommend they go about working with us?
So our organization basically serves as a bridge for communities in order for them to have access to the services and programs that partner organizations have to offer to them. So yes, we we are there to close that gap. Uh, we have established ourselves as a very trusted brand within the Latinx community. So people feel comfortable and safe every time they see our logo involved with other organizations, right?
Mm,
So basically, yeah, we serve as a bridge uh, uh, for our communities and the organizations provide their services. They can reach us, or like they have been doing this time through our telephones. Our telephones numbers and information can be found in our websites, in our Facebook page. They are also for the public to use. Actually, we have been receiving a lot of calls of participants just because we share our telephone numbers and our emails and our Facebook page. So
okay.
they can reach us just calling us or just sending an email. Yeah,
Absolutely.
yeah.
Yeah, and you can find our contact information on our website,
In a website.
sc.org. And we have our different sites throughout the state. We have Spartanburg, Greenville, Georgetown,
Exactly.
Beaufort, Jasper, Charleston, the Midlands. But we know people everywhere. Yeah, so
Yeah, yeah.
definitely reach out to us, the most local one, and then from there we can connect further.
Exactly. And
Um,
I can share my cell phone number right here. It's 803-465-5987, 803-465-5987. So if somebody needs our services, just feel free to call me or contact me. My email is Agner, AGN as 9ER, at scpasos.org. Also feel free to email me if someone needs something. That's why we exist.
yeah, absolutely. And okay, so because of social distancing during this preventative period, how would you say that our team has overcome the inability to meet with people in person?
Nothing substitute the human contact, Mike. Of course, the interaction of the human contact is very, very important in this line of work that we do. But we have been very creative using our cell phones, using our mails, using our cameras in our cell phones, of course. And we have stopped the direct contact with our participants, but we have been serving them as anyway. Like for example, if some family needs diapers for their childrens, uh, we share them an address, so we meet with them, and without contact,
Mm,
we provide them with diapers or food or clothes. So yeah, as a direct contact, we haven't been doing this, but we still seeing our families like in some kind of way,
yeah,
because there are things that you can't do by telephone, by
yeah,
phone, or by email. So yeah. So we have been very creative doing those things, like trying to avoid the direct contact, like
yeah,
keeping the 6 feet distance that everybody's recommending to keep from each other, and trying not to touch every single thing that everybody touches. We use gloves, we use masks. So yeah, we have been very creative serving our families. We have to do it because if we get the disease, who's gonna help them? So yeah, we have to be very careful and very creative, helping our families, man. yeah, so it's very hard. It's very hard.
Yeah. You guys are doing it, and thank you. So I mean, we've already covered where to go for more information, but basically our Facebook is our most accurate. It has the
Oh
most
yeah.
constant updating. We're hoping to maybe create more of these video virtual conversations, maybe make them in real time. We'll see how we can figure that out, and go to our website. But thank you so much, Agner, for your time and your
No, thanks to you, Mike. Thanks to
dedication.
you.
It's,
Oh no, thanks to you. And I also asked everybody to go to our Facebook page as well. In the last 3 weeks, Mike, we have reached more than 7,000 persons with information. So it has been very useful. Our families can find information in Spanish for them to learn and to share also with their families and friends. Thank you, Mike, for this time. Thank you for what you are doing.
you too.
Pasos.
And yeah, and we are here for the community.
Yeah, yeah.
This is all of us are available to connect, and we any questions really send them our way, and we can figure out where the next point person would be, and then support them in the best way we can also.
Of
So
course.
thank you.
No, thank you, Mike. Have a
All
great day.
right. I'll see you
See
next
you
time.
around. See
All
you.
right. Bye.
Bye, everybody.